Good afternoon, everyone, and welcome to the 6th installation of our COVID-19 webinar series, presented in partnership with some of our most valued Gold Associate Professional Member firms. Today, we're thrilled to be joined by Littler to discuss the transition back to the office and considerations for coming out of our working from home environments. The conversation will be led by Phil Berkowitz, and Phil will be joined by his colleague, Melissa Peters, as well as their client and one of IIB's members, Peter Reisman, who is the Chief Communications Officer at Bank of China. As a reminder, all participants are muted, but we encourage you to submit questions through the Q&A function on Zoom or email them to us at info@iib.org. As per our usual practice, following today's session, we will email all of you the slides and a link to the recorded session, which will be available on the IIB's YouTube channel, in the members only section of our website, and Zoom on demand. So Phil, thank you so much. We are really looking forward to what I think will be one of the most helpful and practical conversations we've had around how to deal with the COVID-19 crisis. And with that, I'll virtually hand the mic over to you.
Bridget, thanks so much. Thanks to you and to your great team, Stephanie Webster, General Counsel, and Megan Malloy, who is the Director of Strategic Communication, has been really very helpful in helping us get this together. I do have to warn you that this is my living room and I have 2 dogs. I've asked them to please not walk in the background, but they don't always take my direction. So you may see them wandering around. I do want to, so for those of you who don't know, Littler is the largest employment law firm in the United States. We have 50 offices or so in the US. We have offices in 22 countries overseas, throughout Europe, the Americas, most recently opened in Poland and Austria. We're in Germany, France, and we've just opened our first office in Asia, in Singapore. I have as Bridget said, I'm joined by Melissa Peters. Melissa is a terrific lawyer in our Walnut Creek office in California. She is a workplace safety OSHA expert and has been extraordinarily busy, as you can imagine, during this time. I've worked with her extensively on COVID-19 reopening issues and closing issues and everything in between. And we're also really thrilled that Peter Reisman has agreed to join us today. Peter is Managing Director, as you see here, of Government, Public, and Business Relations. Peter is the real deal. Peter leads a group at the bank on government and public relations and marketing and corporate social responsibility. He received a master's in law from Peking University and a JD and an LLM from Columbia Law School. He is fluent in Mandarin and Hebrew and English, I think. And is just extremely active in the US-China public policy and business realm. So we're really thrilled to have him with us today to talk about what the bank is doing. We're going to, I'm going to be taking you through some issues concerning recent EEOC guidances, and Melissa will be helping you with OSHA and CDC issues, and then we're going to turn to Peter for some Q&A, probably in the last 15 or 20 minutes of our show today. So yes, so just getting right to it. Here's our first slide on return to work, practical considerations. So the issues really go beyond, of course, whether we as an employer are ready to open. The issues are going to focus in part on what are the rules in your particular state. And of course, in New York, on May 28th, the Department of Health issued extensive detailed guidelines on reopening. They imposed numerous rules on practices, from wearing face masks and other PPEs, social distancing, cleaning, testing, contact tracing, and so forth. And so we are under, in New York, some very specific guidelines, which luckily I think correspond largely with what the CDC and other entities, OSHA, have been implementing. But other states are also issuing guidelines, and it's important to know what's going on in your particular state. But the issues, again, as this slide indicates, are not only what the law is and what your state and locality are requiring, but you're going to have to coordinate with your landlord. You're going to have to figure out, many banks, of course, retain many consultants to work with them. So who's responsible for, the safety? Generally, of course, if you've got consultants coming into your workforce, you're going to be responsible, but your consultants, the staffing agencies may be carrying out certain tasks. You're going to want to know what they're doing and being sure that they're doing what's appropriate as well. And then, as Peter would, I'm sure, be first to note, that we also have to be concerned about our media coverage, social media coverage, what's happening in our workplace, what kind of message are we sending to our employees, to our customers, and to the general public. And so there are a lot of issues going into reopening. So let's move forward, please. Okay, and again, before we get to some of the EEOC guidances and other regulatory guidances, banks, of course, are essential businesses, and so they are permitted to remain open even during the, prior to phase 1, 2, and 3. And banks had to determine upfront who could and could not work from home. And those decisions, of course, are driven by business considerations. And we're going to talk about things like data security, VPN access, and confidentiality, and the things that banks and other businesses were required to implement to permit people to work from home. But now the question is, how do we determine who should return, in what order? And obviously, again, we're going to want to rely on legitimate business needs, but there are risks. There are, seniority, and there are other ways of maybe trying to determine what are the best criteria for bringing people back. But there are risks, principally involving claims of potential discrimination. We are apt to want to rely on stereotypes like age, like pregnancy, like disability. Maybe in the interest of trying to protect our employees, we may be unwittingly setting ourselves up as a target for discrimination. And so some of those considerations are risky to consider. And the EEOC, again, has helpfully put together some guidelines that we'll be going into in a moment. But it is important as we develop these return to work policies that and we'll talk with Peter about the steps that the bank is doing along these lines, but putting together a plan, identifying people from various positions and departments in your organization to take account of the needs of all the different departments, and providing a business justification for these decisions. Who's coming back when? Put it in writing, create a plan that identifies the considerations that you're looking at. And I would recommend that generally you want to rely on the job rather than the individual. You want to think about what is the job, what are the functions that we need, and let's bring back those functions. If we focus on individuals, it's riskier and more likely that you'll end up focusing on issues that really we don't want to look at. And of course, on top of all this, employees who we want to come back may be frightened. They may be legitimately concerned about their own health conditions, the health conditions of others with whom they're associated. They're going to be seeking accommodations. And so dealing with all of these human issues as we reopen is going to be a real challenge for your business people as well as your HR people. And that's why training is going to be really important in understanding the best way to respond to these questions as they arise. Let's go to the next slide, please. So as I mentioned, the EEOC very helpfully has issued fairly extensive guidelines. On June 17th, they issued these guidance on numerous issues. And of course, they remind us that the discriminations laws still apply during the pandemic. And you know, there are many issues around the pandemic of discrimination. So you know, I don't have to tell you this Chinese virus, these remarks that I don't want to repeat that President Trump made the other day. You know, these stereotypes, being concerned about there are risks, as I mentioned, in making judgments about people who may have a disability. Maybe somebody was pregnant or is pregnant, maybe because of somebody's age. There are risk factors that the CDC has identified in terms of who is more likely to get sick. And making decisions, though, based on those decisions can be quite risky. You know, we got a lot of questions when all this started. Can we take temperatures of people? And taking somebody's temperature actually, in the view of the EEOC, constitutes a medical examination. And so here the EEOC said, well, let's take a look at what the law says, and maybe we want to reconsider some of these things. And so first of all, yes, you can screen applicants for symptoms of COVID-19 post-offer, by the way, not in advance, but after the offer has been made. And yes, you can screen employees, and indeed you must in New York. New York says every day we have to be screening people who come to the office for illness. So yes, the EEOC has said you can take temperature. You can delay the start date of an applicant who's tested positive for COVID-19, and even can withdraw the offer, the EEOC has said, if the need for the position is immediate. And that's really extraordinary, because the rule has been in the past, you know, if you made a judgment about somebody and you learned, for example, that an applicant was pregnant and you decided not to hire them because they were pregnant, because you thought, well, you might need them pretty quickly for an assignment, that was going to be a very, very risky decision to make. And you'd need to justify it and be able to demonstrate that you might have made the same decision if somebody was going to be out for some other reason. The EEOC just coming forward and say, yes, you can delay the start date, and indeed, they say in the guidelines that you can even withdraw the offer because of this risk, because of the risk of the illness, of getting other people sick. And so these guidelines take account, I think, of the seriousness of the issues. Let's go to the next slide, please. So as I mentioned before, yes, taking an employee's body temperature is a medical examination, but because of the risk and because the CDC and other authorities have acknowledged the risk of community spread, employers may measure employees' body temperature, but there are still other requirements that go along with this role, specifically and in particular, the confidentiality of those records. And there are indeed, I think Melissa can tell you more about certain records that may need to be kept for many, many years, depending on the nature of the test. So yes, we can take these tests. Yes, we can insist on it, but there are going to be some other obligations that follow these things. Another question we got frequently was, can we require a fitness for duty note, an FFD, from an employee? And yes, the answer is yes. The EEOC has said, yes, you can require that an employee give you proof that they're able to come back and do their job, that they're not sick, that they don't have symptoms, that they haven't been exposed. But they also say, look, doctors are pretty busy. They may not be able to get a note from a doctor. So it's okay to provide a form, a stamp. God knows what a stamp is, or an email to certify that they don't have the virus. So building in flexibility to these requirements. And yes, employers may administer tests. The tests need to be accurate. They do not recommend antibody tests because they are apparently not reliable. And yes, again, with respect to applicants, we can impose these requirements, but we must do it only after we've made an offer. Can we go to the next slide? Okay, as I noted before, it's okay to delay the start date and to withdraw the offer. As I mentioned, this is really a major concession on the part of the EEOC. In terms of other risk factors like age, merely meeting the CDC risk factors, and again, these risk factors are things like having diabetes, being morbidly obese, being over a certain age. There are a number of risk factors that the CDC has identified. taking action based only on the presence of those risk factors does not justify withdrawal of an offer. Generally speaking, anything short of exposure to the virus and having the virus is going to be risky. You need to make a particularized decision about an individual, not based only on their risk factors, but based on what their specific situations look like. And then as we get past these issues of screening people out, then what also comes in is the need to accommodate employees who do have a medical condition, who do have a disability, such as the EEOC mentions, a pre-existing mental health condition, anxiety disorder, which may in fact be a disability which the employer may need to accommodate or seek to accommodate if it presents a problem when they're returning. Let's go to the next slide, please. And to follow up on this notion of accommodating disabled employees, the employer does not have an obligation to accommodate if doing so would constitute an undue hardship. Now that is normally a very, very difficult standard to meet, but the EEOC has said in this guidance that they recognize that it may be difficult to accommodate people and that issues that may have not have presented an undue hardship before may in these current circumstances constitute an undue hardship. And again, you want to consult with counsel before making that decision, but they recognize that during this virus, it may be more difficult to provide temporary assignments, to hire temporary workers, and so forth. One question we have gotten a lot is, for example, what if somebody doesn't want to come in because somebody in their family may have a risk factor or they're afraid about spreading the virus at home? Well, of course, the employer can consider that and can make the decision to accommodate that individual, but the law does not require it. The law does not, only requires a reasonable accommodation for people who are disabled. And unfortunately or not, the law does not require an accommodation for people who, other than the worker, who are not disabled, so members of their family and so forth. So there's no obligation to make a reasonable accommodation for individuals who are not disabled, employees who are not disabled. And the EEOC does point out the demeaning, derogatory, the kind of nasty remarks that have been made about Chinese people and other Asian people, and caution employers to be on the lookout for those kinds of comments. Let's go to the next slide. There's another concept. We spoke a moment ago about undue hardship. The other concept that I want to mention briefly is the idea of direct threat. And there, an employer can exclude an individual from the workplace if their presence would constitute a direct threat to their health or to the health of other employees. But again, we can't rely on stereotypes such as pregnancy, age, prior illness, or other kinds of disease. We can't decide that a history of past illness constitutes a direct threat. If your managers are considering these issues, you need to be sure that they are receiving appropriate training and guidance in making these determinations. HR needs to be involved, and any decision to exclude somebody because we think they may present a direct threat really needs to be reviewed by somebody at either the HR or at the legal level to avoid any claims after this whole mess is over, because we do anticipate there are going to be a lot of lawsuits that come out of these, the furloughs and people returning to work and so forth. And again, the EEOC talks about reasonable accommodations for people who have disabilities. So it may be that we will have to provide them with a separate place to sit, provide them with other kinds of accommodations to permit them to come to work. And there are obligations in terms of reasonable accommodations to enter into an interactive dialogue with the individual and to document the decisions. And indeed in New York, there's a requirement to provide the employee a copy of any documentation that you may create in considering an accommodation, and particularly if you deny the accommodation. And the next final slide for me, please. Again, in summary, the EEOC reviews the issues of direct threat. They reinforce the idea that there's a high standard, that we can't exclude employees unless there's no way to provide a reasonable accommodation. But again, they do recognize that the pandemic may make undue hardship more likely for the employer to be able to prove. And with that, I'm going to turn things over to Melissa, who's going to talk more about other things. Thank you.
All right, thanks, Phil. Great. Megan, if you could advance the slides, please. All right, return to work issues. Hello, everyone. My name is Melissa Peters. So basically, when we're talking about return to work from a safety and health perspective, the key is going to be creating an effective safety program that accounts for and shifts with the changes in local and state orders and CDC guidelines, as well as OSHA guidelines. OSHA finally decided to speak last week and provided us with some return to work guidance. The good news is that we anticipated what they were saying. They pretty much have confirmed that they are following CDC guidelines, and that is the way we have been counseling clients since the beginning of this. So that was good news for all of us. So you can go ahead and advance the next slide, Megan. Something that people, certainly in cities, metropolitan areas like New York, are going to have to be thinking about getting to the building, transportation challenges with return to work. Transportation systems will be reducing capacity. In some locations, this is going to require employers to adjust start times and implement new shifts or reducing on-site numbers. The key is to be flexible and creative, and it's recommended to maybe consider bringing back only those employees who must work from the office. There's also going to be issues with commuters who drive. They're going to have to deal with, a parking situation. Is their parking garage open? Are there going to be additional, who knows, social distancing measures that are implemented with where they usually park? So these are all things that, companies are going to have to consider. Go ahead, Megan, to the next slide, please. Then we get inside the building. We're going to have to deal with site-specific challenges. There's going to be issues with queuing for the elevator. So if you're in a high-rise building in New York, and let's say you occupy the 30th through the 32nd floor, you're going to have to consider how you're going to handle employees who may have been at the building in a timely manner, but it takes them half an hour to get up to the floor. These are things that, of course, we've never had to think about before. We're going to have to accommodate employees and start thinking of these things and coming up with plans to accommodate them. This is also going to require accounting for office meetings during the day. If they're leaving, going to a lunch meeting, going to a customer site, perhaps. There's going to be an impact on access by visitors and vendors as well. Will they be able to even get to the building? So you also have to think about, if you're an employer and you own the building or you're responsible for the management of the building, you're going to have to think about things that could have arisen during the shutdown. For instance, is there going to be an issue with mold growth in the ventilation system? Is there going to be an issue perhaps with rodents or pests? Stagnant water systems in the AC? You have to think about things like Legionnaire's disease, Legionella. So it's going to be difficult. If you're just a tenant in the building, you really should go ahead and coordinate with the property manager or the owner to obtain information and confirmation in writing that the building owner or the building management has complied with CDC guidelines and requirements regarding these things. Go ahead, Megan, you can move to the next slide. Something else that is going to be difficult, or something we're going to have to consider, is workplace reconfiguration. You're going to have to work with the actual inside of the offices to be able to comply with the social distancing requirements. So this is going to require you to limit the movement of people, figuring out what can be done to keep people socially distanced at all times. You're going to have to add, sanitization stations, limit any contacts, high-touch surfaces that are shared, like copy machines, printers, coffee pots in the break room, anything where people are used to touching, even like, refrigerator door handles. If you supply, LaCroix to the office, you're going to have to think about, setting out an extra package of wipes there to make sure that people disinfect the refrigerator handle every time they go in to get a can of LaCroix. Something else that's been pretty cool, some of our clients have installed kick touch pedals on restroom doors or other doors, So that eliminates the need to actually use your hand to touch the surface and open the doors. Go ahead, Megan, to the next slide, please. Face coverings, of course. So in New York and many other jurisdictions, we know that when in public or in retail situations, and certainly in office environments or any other workplace, people are required to wear face coverings. And face coverings are not personal protective equipment. We all know that's a respirator or an N95. What we're talking about is a cloth face covering. However, you know, it's something that's part of the new reality. And, you know, all employees are required to wear face coverings in any common areas or anywhere else that they cannot be 6 feet apart. Go ahead, Megan, please, to the next slide. So with the requirement to wear face coverings comes a lot of different legal issues. There's going to be issues with donning and doffing. So that's like the appropriate, you know, OSHA speak for putting on and taking off the face coverings. Of course, it's going to be important for every employer just to have a very basic, simple policy about face covering cleanliness and storage. So whether or not you provide the face coverings for the employees or allow them to wear their own, it's important that you emphasize that they need to have one that's clean. So if you're providing cloth face coverings to people, maybe give them 5 and allow them to launder them throughout the week or whatever. Alternately, you could provide disposable face coverings, the paper masks. So there's a lot of different options with that. Of course, there's going to be accommodations. Phil mentioned briefly some of the ADA issues. You know, if anybody has hearing or respiratory issues, you know, we were dealing with a situation where we had deaf employees who needed to be able to read lips. So they needed to have a face covering that accommodated this. So we had to come up with, you know, a clear plastic face shield for them to use so that they were able to read lips. These are things, you know, people are going to have to think about. Obviously, if an employee requests an accommodation, you have to engage the employee in the interactive process regarding that requested accommodation. Certainly, if there's no legitimate basis for not wanting to wear the face covering, you can discipline employees for failure to comply, because at this point, wearing face coverings constitutes a safety and health policy. So it would much be akin to failure to follow regular company policies or procedures. So go ahead, Megan, to the next slide. The key for a successful return to work is putting together an effective exposure control plan. So, you know, you need to figure out your protocols and procedures for sending employees home. If an employee is sick or exhibiting symptoms of COVID-19, you have to send them out. You know, do you have some sort of policy created? Who's going to be implementing the policy? Most of our clients have been using their HR department. Peter's going to speak to you a little bit about the way that the Bank of China has been doing these things. I think they've been doing a really great job. I've worked with them some on that, but you'll get a better idea of sort of how, you know, there's practical implementation of these requirements. You know, you're going to have to institute contact tracing. If you have a positive employee, what are you going to do, or what is going to be your process for trying to identify other persons that they have come in close contact with? We recommend keeping a contact tracing log, an exposure log, to make it easier for an employer if they do get a positive from one of the close contacts. Because if OSHA comes knocking or you have a complaint, you're going to have to be able to establish that you have implemented measures, and you're going to have evidence of that measures that you've implemented. Those are things that are going to be important for reducing liability going forward. You know, we're going to talk a little bit in detail about cleaning the workplace. I'll go to that in a little bit. Record keeping, reporting to health agencies. That's only required in very few jurisdictions. I know, for instance, Los Angeles just changed their reporting requirements. They now say if you have 3 positives within the past 14 days, you need to report to the local health authority. Previously, it was 5 in the past 14 days. So you just need to make sure you check with your local jurisdiction to understand if you have any reporting obligations to the local health authorities. Reporting and recording for OSHA purposes. OSHA basically has come out and said that they want everyone to do an assessment to ascertain whether or not a case of COVID-19 is work-related. Part of that assessment requires asking the employee where they think they got sick. So, I mean, it's not really, I don't think like the best method. I think what you should do is go ahead and assess other factors as well, as opposed to just asking the employee where they think they got sick, because I don't know how reliable that actually is. Look and see, you know, do they have any family members that are sick? Have they been traveling? Have they been socializing? Any sort of other indicia of places that they may have received, you know, or been exposed to COVID-19 outside of the workplace. If your determination is that it occurred in the workplace, they were exposed there, great, you record it, and you report it under certain circumstances that are a little bit too detailed to get into at this point, given the amount of information we have to cover. So certainly, you know, call your counsel, talk to them about that if you think you have a situation or you're not sure whether or not to report. Okay, so job site cleaning, basically the gist with this is making sure that there's regular cleaning that's happening for all common areas, ensuring that you're keeping track of how often the cleaning is occurring. That is something else I would recommend keeping records of. You know, is the bathroom being cleaned how many times a day? You know, note the times. Any trash that's collected, you know, should be collected by somebody wearing latex gloves and appropriately disposed of in a closed container. Frequently touched items, go ahead and make sure that they're disinfected frequently. Next slide, please, Megan. So CDC recommended cleaning protocols. The takeaway from this, the important thing, is if you can wait 24 hours to commence cleaning, if you've had a COVID-infected individual in the workplace, go ahead and do that. If you can't, wait as long as possible and or close off the areas where the sick person has been. And that's, you know, to disperse the respiratory droplets from the air, so nobody else is going to be exposed to that. The key is that if it's less than 7 days since a C+ individual has been at the workplace, you've got to do a cleaning. If more than 7 days have passed since the C+ individual has been in the workplace, no necessary additional cleaning or disinfection is required. Of course, make sure the people that are cleaning are wearing the appropriate PPE. I would recommend a face covering, latex or nitrile gloves, and an isolation gown if possible to protect their clothing from being exposed. Okay, next slide, please. Health screening and testing. Almost every jurisdiction is requiring mandatory health screening, whether it's through questionnaires or temperature checks. You know, you need to check with your local jurisdiction. Everybody has different requirements for this. It's definitely easier to do a questionnaire type situation or have employees do some sort of self-check at home before coming to the work site. There are certain jurisdictions that are requiring on-site temperature screening that is conducted by the employer. Again, it's changing frequently, it's changing by locale, so it's necessary to go ahead and always check with your city, county, and state orders. Next slide, please. Again, there's going to be issues with health screening and testing, safety, privacy, record keeping. OSHA has said that if it constitutes a medical record as defined under the regs, which means that you know, it was a test taken by healthcare personnel, the employer is subject to the 30-year OSHA medical record retention, which is insane. So the key is if you're doing temperature screenings, try not to collect the information, just do sort of a pass-fail and or maybe not have healthcare personnel take those health screenings. Maybe have a security guard or somebody else. Go ahead, next slide, please. So New York reopening guidelines. I'm not going to go into it in detail. We basically included this in our webinar as a resource for you. There's a lot in here, but we want to move forward so we can go ahead and get to Peter's portion of this. The key is to have a communication plan, make sure you're communicating with employees, you know, workplace activity thing that I had already spoken about working from home, social distancing, etc. Next slide, please. Essential worker guidance. There's a lot of interesting stuff in here. Again, it's pretty verbose, so I'm not going to go into it now. And workforce re-engagement. Let's see. Actually, could we go back one slide? I think, Phil, you wanted to talk about that.
Yeah, I'm not sure if the slides are in exactly the right order, I'm afraid. But this is, I plan to just spend a couple of minutes talking about the fact that numerous regulators have issued guidances on COVID-19. One of them is the Department of Homeland Security, and they have issued a guidance principally on determining who is an essential worker. And again, this is something you can find online, but I will be briefly talking about the other guidances that some of the other agencies have circulated. But Melissa, I guess that why don't we just follow the slides in the order they're in?
Okay.
And Peter, we're going to get to you, I promise.
Okay, perfect. So go ahead and advance, please, Megan. Thank you. We'll just.
Okay.
Oh,
So there we are. All right, good.
Okay,
so
cool.
the OCC has also issued a guidance. The OCC really, their focus is on stay-at-home workers and accommodating them. So their first, they spent a fair amount of time talking about how banks need to be doing things like giving stay-at-home workers identification cards and other documentation in case they were stopped in the street by police. They also ask the question, how long does COVID-19 live on paper money? They say they don't know, but it was an interesting question to raise. And Megan, please, the next slide. The other thing that the OCC recommends, and you'll see that the other 8 entities, the regulators have spent a lot of time on, is they make clear their view on preserving confidentiality of sensitive customer, client, third-party data. It's interesting because many banks, of course, previously didn't let people work from home. Most people, to get VPN access, it was highly restricted. And now, of course, many of the banks have just flipped that around. So many people have this access. There are issues, there are, of course, the technical issues in making that happen, but there are also the softer issues of implementing policies and guidelines and reminding employees of good cybersecurity practices. Next slide, please, Megan. The New York DFS is not going to be left out of things. And so they have also issued a guidance in April, similar to the OCC, concerning principally data security. They also identify the risk of BYOD devices, remote audio and video conferences. They talk about phishing and other kinds of fraud training, and they talk about coordinating with third-party vendors to make sure they're on top of things. Megan, please, next slide. The FDIC's contribution, well, mostly they're talking about the security of deposits, and most of their guidelines, their FAQs, don't really deal with employment-related issues. They do raise the question about giving training to tellers in case they see somebody come in. How do you distinguish somebody wearing a mask who's a customer from somebody who's there to rob the bank? I kid you not. So that was an interesting question to raise. And finally, OFAC, last slide, please. Actually, OFAC as well as FinCEN, OFAC and FinCEN both talk about, you know what, if you're going to be late in reporting, let us know. That's their main message. And I think with that, Melissa, you had a few more points you were going to raise, and then we're going to go to Peter.
Yeah, and I think, it's probably more interesting for everybody to listen to Peter talk. So we'll just, these next couple slides are just about workforce re-engagement, and you guys can scroll through them when you have access to the webinar. Basically, the gist is that you have to realize that the next normal is going to be different, and there are going to be things that you're going to have to think about. There are going to be questions that employees have. There's going to be requests that employees have that they previously haven't had before because we haven't been working in an environment like this. So there are going to be some, important tips for you guys to follow. I think these last 5 slides are certainly interesting and a good outline, sort of just a checkpoint to go through and see if there's anything that you haven't thought about already. And if that, with that, I'm going to turn it over to Phil and Peter.
Okay, thank you so much. So Peter, thank you again for joining us. So please, Peter, tell us who you are and a bit about your role at the bank, if you would.
Well, thank you, Phil, and thank you, Melissa. I really wish I had this exact presentation 4 months ago. It would have saved us a lot of time and effort, but a really detailed presentation. And thank you, Megan, for inviting me to join today. I am the Chief Communications Officer for Bank of China USA, Managing Director that runs all of our government, public, and business relations. I guess my role here in today's panel discussion really comes from my role on what we have as a IMT, our incident management team, which was the primary team or committee responsible for all the decisions and planning around the COVID-19 outbreak.
So, well, Peter, so you said a moment ago that you know, you wish you had these slides 4 months ago. Actually, you helped us put these together, I would say. But Peter, so what were the key challenges facing you 4 months ago? I mean, tell us about what happened and how you made reference, of course, to the incident management team. We want to hear all about that. What led to its formation? What was going on 4 months ago?
So I think, as most banks have in place, our business continuity plans. As part of our business continuity management, we have an activation of what we call an incident management team, which covers various, crisis management in some banks, incident management in ours in this case. And so we activated our incident management team in mid-January. We were quite early in the process. It's a very much of an interdisciplinary approach. Where we grab representatives, key representatives from various departments, from operations to corporate banking to retail banking, really just the vast, from clearing, the vast gamut of sort of core operations for us. We did later create a more expanded IMT sort of meeting room that met on a weekly basis. But our core IMT met at that point on a daily basis, pretty much through January, February, March, and April, and I would say really only in May and now in June has the IMT been meeting more on a weekly basis.
You know, I want to mention, by the way, we are getting a few questions in, and we will try to turn to them before we end. Peter, you mentioned, I mean, before we move on from this issue, you started in January, and you mentioned that an incident management team, obviously it's not called the COVID team, there's a generic term for this. And you talk about business continuity and crisis management. Is this something that the bank has, it's sort of a team, the idea of an interdisciplinary team to handle a crisis, is this something that the bank had in place in terms of a practice? Is this something you brought to the table? How did this all come about?
So again, we have the business continuity management, which yes, within our procedures, we had already the concept and procedure around an IMT. I mean, what's critical for it is, and we also have, of course, pandemic planning, which is required by the regulators as well. Fortunately, we'd actually just gone through our pandemic planning review with the OCC. And so we were, but again, the current pandemic, I don't think anybody was completely prepared for. And so, we had a lot of catching up to do in terms of how the real impact of how this was going to play out. But we had challenges. We had issues in terms of remote access. We wanted to make sure that we had the right contact tracing mechanism in place. We were, of course, following CDC guidelines, federal, state, local health authority guidelines from the very beginning. And in some cases, we went above and beyond those guidelines. One of the things that we had implemented early on, where you had the 14-day quarantine period from travel from certain countries that were level 2, level 3 risk by the CDC. Our list was slightly more expanded once we started looking at the numbers. We didn't wait for the government to declare those countries as a higher risk. One of the other key decisions we made, where most banks and companies, and even the recommendations were, if you were infected or had been exposed to COVID-19, then you were required to go into a 14-day quarantine period. But not many companies were instituting where if you were living with somebody that had been to one of those countries recently. So if my wife, for business or personal reasons, had been to Italy and just returned, a lot of people had not instituted that part of the restriction. So we were quite early in doing that. We did have several cases within the bank, fortunately none fatal. But I think the small number that we had, I think was certainly due to some of the early measures that we took on at the very beginning.
Well, indeed. I mean, I recall some issues arising even in before the closure of, things like interviews and, applicants coming into the bank. And well, did we want to, interview anybody at all, or did we want to restrict applicant interviews to people who maybe didn't meet some of the risk factors? If they traveled, of course, overseas, we were not going to have them come in. So there are all of these issues that are, and legitimate concerns of the managers who are going to be interviewing these folks in this new environment. I remember that
Very much
being
so.
an issue.
Very much so. And we started with sort of asking and getting people to sign off on whether or not they have traveled to these countries. But at the same time, we were already looking into putting in new procedures in place for remote interviewing and so forth. And so, it was a learning as you go, but I think we implemented things as quickly as we could.
And so and Melissa, please feel free to speak up if you've got any questions, okay? Of course.
Sure.
But you'd mentioned that I think initially you were meeting once a day, and now has that slowed down a bit, Peter? And
that IMT is now slowed down. We're pretty much back to, we're about once a week right now, unless there are critical issues that come up. Certainly the last couple of weeks, we've had a few more meetings regarding the return to work policy and procedures and communications with various stakeholders. Even very early on, the communications was critical with the stakeholders, not just the employees, the clients, but also the regulators.
So let's, I actually wanted to ask you a different question about remote supervision and the efforts to preserve confidential data, but I'm not going to let you talk about the regulators and move on without asking you the question. So what were their key concerns?
The key concerns were, of course, well, first again, we had just gone through our pandemic review. So the concern is always about the client. It's about the client. It's also about the employees. From our internal, our response to the regulators was quick, was early, was detailed as far as what we were doing in terms of cleaning within the building, restrictions that we had around travel restrictions, operations, including the activation of our disaster recovery site. That was critical for us to make sure that we had that prepared for various departments to go to the disaster recovery site, even travel to and from the disaster recovery site, and accommodations at that site for a much longer period of time than, say, most DR sites would be open for.
And what can you tell us about data security? I mean, I think many of our bank clients and a lot of our clients in general have taken the position over the years that, for example, if you wanted to work from home, that was going to be an accommodation that was going to be difficult to grant, because people saw the benefit of being in the same office with people, to be able to interact, to be able to supervise effectively, and how did the bank deal with that issue? And I think that was the bank's view of things pre-pandemic, pretty much.
So I think it's both. You have the data security concerns as far as making sure that everybody had access to VPN. So if everybody has access to VPN, it's technically we are accessing our computers as if we are at work. Then you have the issue of data security, even around conference calls and Zoom meetings. Certain, I don't want to sort of say anything bad about any specific platforms, but there were security concerns about using one platform or another that we had a painstaking process to go through to figure out which we wanted to be on top of. As far as data within the building, we don't use a lot of cloud services for our operations, so everything is housed internally. Some other firms, I think, have cloud services that may have other concerns, but really that wasn't a concern for us. But I think the most part is, again, having the meetings online or on conference calls. As far as client information, again, the VPN access, we originally had a smaller number of people within the bank that had VPN access, and making sure that we had that rolled out to everybody in the bank, including the consultants as well. We had to roll out VPN access to for various projects.
So talk to us, Peter. Your title is communications. tell us about communications during the pandemic. What do they look like? What's different? And to customers, to employees, you've got a lot of stakeholders.
So I would say communications for us was and for any company is critical. It's key. You first have to identify the stakeholders, which again, you have your employees, semi-employees or consultants, if you will. You have on-site consultants and off-site that come visit the building from time to time. You have your clients, and then you have the regulators. And we put out notices very early about any change in services. They were either sent in their statements, posted on the website. We did close one of our retail branches in Manhattan for a period of time. We recently reopened that. And so even that communication is critical to not just the clients, but also to the regulators and keeping them informed. And you never want the regulators to find out anything after the public finds out about it. So for us was really making sure that the regulators were informed. And then later, in addition to making sure that our clients and our employees were informed. We had several forms of communication that came out during the period and still continue today. Our business continuity management, or IMT, has a email that comes out through a central system, and people can respond to a central email with questions or comments. And I think setting up that level of communication for employees to be able to ask questions, voice their concerns, make suggestions, I think was very important for us to have along the way. We also instituted a CEO letter that went out and still goes out on a bi-weekly basis. It goes out once every 2 weeks, and it includes both updates from the CEO about the general situation. And it also included, we decided to take a format where it included achievements by various departments. So that way, you don't have the same day-to-day interaction and conference meetings as you used to have in the past, or even that interaction with executive management. And so it's almost turned into a little bit of a competition, I want to say, where departments, I have to admit there was maybe a mistake that happened once where I forgot to include a department's achievements over the last 2 weeks. And my emails did not stop for the next few hours about how we could forget a specific department and the hard work that they had accomplished over that period of time. So again, I think communications is key. The CEO letter was important. The communications to clients about keeping our services, our availability, even though the people can come into the branch. Your online services also had to evolve, but we were pretty well prepared for that as well.
And what about, I understand you spoke a lot about communications to employees, but what kinds of practices did the bank put in place to make clear their interest in their welfare and their safety?
So again, we did have weekly, almost, I want to say earlier in the process, weekly or bi-weekly emails that came out from our IMT or BCM email systems that talked about sanitation of various workplaces or floors. When we had a COVID infection, an employee who got infected on a certain floor, that floor was then evacuated. It was then sanitized that same day. It was a 2-day waiting period to bring people back into the office until this was, again, before everybody was working at home. And
then the bank was also doing things like providing meals at free lunches or dinners, things like that.
On the meal basis, when you had the social distancing started to get into place, we do have a cafeteria. We then started to have sort of more of a takeout service. We started providing masks. We are now providing masks on the return to work policy as well. I would say even the consultants, we had to make sure that communications lines were open with the consultants very early on when we did have a case even with a consultant that became infected with COVID-19. So I think the entire communication strategy is simply just a critical element to make sure things run smoothly.
And Peter, I do want to try to turn to one or two questions we've got, but I want to give you a chance. You mentioned to me when we were preparing for this, the value of having access to your peers via the IIB. What can you tell us about
There's
that?
two things I want to, one more thing I wanted to add. One of the other key things that we had done throughout the process, or throughout the last several months, is also on our corporate social responsibility front. We had done we had donated over 120,000 PPE equipment to frontline responders, included police, postal, sanitation. We've given donations. I think that was also very important, both for our employees, for our clients, but really just giving back to the community was a critical piece. Megan and I have seen each other quite a lot over the last several months, and that's because IIB was really quick to respond in creating a communications committee. Actually, I think the committee, Megan, I think we created that before, but during this process or this period, data is everything, and information and best practices and market practices, everything. And so Megan and IIB really created a great committee of all of the IIB members that we met, I think, earlier on, maybe a little bit more often, but we're still meeting even today to really share our best practices and understand what are some of the other banks doing. What are they doing in terms of travel, in terms of commuting, in terms of face mask wearing, in terms of social distancing. You know, a key issue, which I think Melissa brought up as well, is going to be the commuting and the elevators. You know, we're struggling with the decision right now. Is it better to keep people at home where they're being actually very productive? Or do we want people to have to, you know, go to the issues of commuting to work? And I think Melissa mentioned 30 minutes on the elevator. I think Goldman Sachs and I think ourselves, our estimates are somewhere more closer to an hour to 2 hours to try to get up and down the elevators early in the morning and late in the afternoon. So
Wow.
that is going to be very challenging for companies to really make a decision. You know, we just started this Monday, are now at 5% capacity. We will look at the numbers. We have different criteria over the next couple months to decide, you know, how we ramp that up from 5% to 10 to 20 to 50. Some banks are not expecting to get back to full capacity before the end of the year. And really, we're just going to have to look at the numbers and the data to see where things turn out.
Peter, thank you very much. It's fantastic. I really appreciate your insights. I can tell you that our firm, you know, we have I'm not aware that we have any plan to reopen our offices in New York for all the issues you've identified anytime soon anyway. Thank you again. I want to turn to one or two of the questions with the few minutes we have left. And one of the questions is how are employers approaching the New York State DOH requirement regarding employee attestations? Is it required every time an employee comes into the office, or is there a blanket attestation procedure that people are using? And I mean, what I would do is, and I'm going to ask Melissa if she knows the answer to that question, but I'm just reading the New York Department of Health guidance, which says that responsible parties, which means employers, must implement mandatory daily health screening practices daily, and that they may be performed remotely before the employer visitor reports to the office, or may be performed on site. At a minimum, screening is required for all employees and completed using a questionnaire that determines whether they've been in contact and so forth. So it appears to me that this is a daily requirement. Melissa, anything you would add to that answer?
Yeah, and it's funny, I was answering that, I was typing the answer to that question.
Oh, okay.
No, it's fine. The thing jammed up, it worked out well. I would say, obviously, you got to follow the local rules, and if it's requiring daily screening, you have to do it. Certainly, if people are coming in to the office, I would do it just from a liability perspective. Also, from an OSHA standpoint, you know, if you have to respond to an OSHA complaint, they're going to want to know what you've been doing to ascertain the health and safety of employees and what you're doing to ensure that the workplace is safe and healthy. And when you are able to say, you know, every time someone comes to the office, or we have vendors or whomever, they're entering our space, we are requiring them to do this mandatory screening check. So
And there's
that's what
one
I'd
other
recommend.
interesting question we have, which is what are we seeing firms doing in terms of facilitating working from home? Are we paying for monitors, docking stations, high-speed internet if an employee doesn't have it? And that's a very interesting question. And I'm going to just say that the answer, again, as Melissa says, really depends on where you are. New York does not require paying for this. And you can mandate that an employee, buy a computer and hook it up at their expense. Our firm, by the way, has given Chromebooks to the extent that you don't have a laptop. We've given our secretaries Chromebooks so they can all work from home. But if you're in California or you're in Illinois, in Chicago, you have to reimburse individuals for all of these expenses, the cost of their cell phone, the cost of maintaining the internet and so forth. And if you don't, there have been class actions in California in particular where the rules have been very, very strenuous. So, I think that I'm not sure that there's a uniform answer to the question, but the legal answer depends on where you are. I think we've used up our time. Bridget, there you are. Peter, again, thank you very much.
And
thank you, Phil. Thank you, Bridget. Thank you,
thank you, Peter, Melissa, Phil. As I mentioned at the outset, I know this kind of practical, actionable insights, advice, suggestions, very helpful to IIB members as everybody grapples with, the return to office, and especially since our membership tends to be heavy in terms of New York and California. It is actually very helpful to have that kind of New York specific and some of the California information. So we appreciate that. Reminder to everyone that you'll get an email with the link to the recorded version so that you can refer to this. And of course, can reach out to the experts here at any time. So with that, I want to say thank you, and everyone stay well and stay safe.
Thank you.